For these basic lessons, your patient's incision should run left to right in front of you. Think spay incision how your patient is placed on the surgery table. Remember, you will not be able to move your patient during the lesson since you cannot rotate your patient on the surgery table. Your left hand will hold your tissue forceps using a pencil grip. Your needle holders will be held in your right hand with your thumb and ring finger in the finger rings and your pointer finger extended forward to stabilize the needle as you push the needle through the tissue. The tip of your needle holders are used to grasp your needles about 2/3 the way along the body of the needle, and it should be held perpendicular in the needle holders. Let's review some terminology. A bite is the act of pushing the needle through the desired layer of tissue. That is a bite. A throw is when you align your needle holders between the tail and the needle of the suture, wrap the suture around the needle holder, grasp the tail, and pull it through the loop. That is a throw. If you want to make a knot, you need 2 throws. So I'm going to realign my needle holders. I'm going to wrap around once. I'm going to grab the tail, and I'm going to pull it through. You now have a regular knot. You're going to hear us refer to something called a surgeon's knot. A surgeon's knot begins essentially the same way as a regular knot. You're still going to take that bite. Line this up so you can see better. You're going to align your needle holder still between the tail of the suture and the needle of the suture. You're going to still wrap around the needle holders, but here's where it's different. A surgeon's throw has 2 wraparounds. You're going to grab the tail and pull it through again. Now remember, it needs to be a knot, so you have to do another throw. The second throw is a regular throw. So realign your needle holders, wrap around once, grab your tail, not your skin, grab your tail and pull it through. You now have a surgeon's knot. Okay, let's begin our simple continuous suture pattern. A continuous pattern consists of a knot, several bites, and a second knot. So you're going to begin by making your knot. You need a bite, your initial bite will begin on the opposite side of the incision and come out the close side of the incision. You're going to realign your needle holders between the tail and the needle, wrap around twice because you need to do your surgeon's throw, grab your tail, pull it through. You're going to do a regular throw, so wrap around once. You now have your surgeon's knot. One more knot will make it secure. This one's regular, so wrap around once and wrap around for your second one. Now, for a simple interrupted, I would take these 2 ends and I would cut it right here, and you'd wind up with one little knot. Because it's continuous, we need to put multiple bites in here. A continuous pattern, you will move your suture over about 4 to 6 millimeters. You're going to go in on the opposite side just like you did that initial bite, and you're going to come out close to you. Make sure when you bring your needle through, you don't come through the loop, you want to come on the outside of your loop. This will be important because there's a different suture pattern that you go through the loop. So there's my first bite. Now, I'm going to continue. I'm going to move over about 4 to 6 millimeters. I'm going to go in on the opposite side, out on the close side. My shammy is failing me. Okay, let's repeat this process a couple times. A bite all the way through. Stay on the outside of my loop. Another bite. Okay, you don't want to make these so tight that they're pinching and puckering your skin. You want to be able to slide needle holders or hemostats through the middle of your incision, your suture pattern. Okay. Ideally, each of these will be equal distance from your incision on either side, and they will be equal distance apart. This last one was a little off. We're going to place one more. Okay, let's finish off with the second knot. Okay, instead of pulling it all the way through, we're going to leave a loop. That's going to be our tail end of our suture now. Align your needle holders along the incision between the new tail, the loop tail, and your needle. You're going to wrap around twice because we're going to do a surgeon's throw and pull it through. Realign it, do our regular throw, grab our loop tail, and pull it through. We need to put another knot to make it secure. So single loop, grab the loop tail, the last one, grab the loop tail, and cut. Okay, you can see because you used a loop as a tail, you actually have 3 tails coming out of this knot. That's okay, that's what it's supposed to have. Okay, and there is your simple continuous.